talking Joe podcast, minds in motion. Talk about relationships, help your emotions. Behavior management when your kids start to losing it. Talk about life and all the confusion. Minds in motion. Minds in motion. Talk about relationships. I'm talking Joe podcast, minds in motion. Talk about relationships, help your emotions. Behavior management when your kids start to losing it. Talk about life and all the confusion. Minds in motion. Minds in motion. Talk about relationships. Emotion. Minds in motion. Talk about relationships.
Good evening, everyone, and welcome to Minds in Motion with me, your host, Joel. It's a beautiful Wednesday in Toronto. Finally, we're getting wonderful weather. I want to say thank you in advance to all the viewers that are tuning in on all the platforms that we're streaming on tonight. That's TDN TV, Facebook, TDN TV, YouTube. We're also on Twitch and we're on Instagram tonight. We're also on 2 radio stations. That's GTM Radio, online, and SBE Radio FM. So thank you very much for tuning in. And also don't forget, you can text your message to 647-495-3224. All right. So tonight I have a wonderful guest that I've been waiting to get on this show. And I'm just going to bring her up to the stage. And her name is Dr. Ashley Sebastian. Dr. Ashley Sebastian, thank you so much for joining us on Minds in Motion. Welcome.
Thank you for having me. Pleasure to be here.
All right. So I'm excited to have you, as I said. It's a rarity to see a Black physician, and let alone a female Black physician, in our parts of the city, like in the Peel region. And I was really trying to get you on, and I know you had kind of just opened your practice when I reached out to you, and you said wait, and you honored that, and I really appreciate your time for being on the show tonight. So tonight, I really want the guests to hear about your experience working with our community, our communities, I should say, the African and Caribbean diasporic communities. But also, I just want them to know where you're located, because we talked a little bit backstage, and you're taking a few more patients, and then you're going to close off in a little while. So before we get into that, let us know a little bit about Dr. Ashley Sebastian.
So I am a primary care physician in Brampton. My practice is at 18 Kensington. And like you said, I'm approaching the threshold where I may have to stop taking patients, fortunately. So this has been a great, start to the year, filling up so quickly. And my practice is primarily made up of patients of the African diaspora, African Canadians, African Americans, Afro-Caribbean patients. So it's been an honor serving patients who look like me and being back in my hometown.
Yes. So I like how you said that, patients that look like you. So when I posted, I said, are you looking for a doctor that looks like you? Right. So it's nice that you said that, because sometimes our community can be very closed off or not as trusting if people don't look like them, because sometimes people don't understand them. So I'm just gonna. So what brought you back? You said you came back to Canada. I know you kind of give a little bit on your social media pages. So how I found Dr. Ashley was on her social media page, TikTok. So check her out there. So what brought you back to Canada? Like, why did you choose Canada to practice?
So I initially started off practicing in the US after I graduated residency. And in contrast to how I practice now, I was in a very rural community in Arizona, primarily Caucasian geriatric population. So almost a complete 180 to where I am now. But I came back to Canada because I have family here. I have not lived here in 10 plus years. So it was about time that I came back to be with my family. My sister had a baby. So a lot of things were changing, and it just felt like the right move professionally for me. And it's been a great experience so far.
Okay. All right. Well, thank you for that, because now we have a good number of doctors that look like us here. So as I said, I'm just going to get into the questions for tonight. So the first question that I have for you, I have them written down, so I'm going to let's talk about the mirror effect. So as we spoke about just now, what was the moment you realized that your presence as a Black woman in the exam room changed the dynamic for your patients?
So this happens quite often, where patients open up to me and telling me that they feel comfortable disclosing certain information that may be judged or perceived different from different cultures, right? So there have been a lot of moments where people have said, I've never had a Black doctor, or I've never felt seen or heard, which is quite common. And it more so relates to how I'm able to address their concerns without judgment, but also coming from a place of lived and shared experience, particularly around racism. Lots of patients have had situations that may have been brushed off by other physicians as something trivial or meaningless, right? But there is a shared connectedness and a shared understanding of when certain behaviors from others are racist, and ultimately leading to things like mental health concerns that may have been brushed off by other providers. So little examples like that are very common, but coming from a place of shared and lived experiences where patients are able to open up to me about things that they didn't feel comfortable with others.
Yeah, I like that.
Yeah.
You mentioned that, because that alone, people are already asking questions.
Okay.
They're already wanting to know
Yeah.
where you're located. So we did mention at the top of the show that Dr. Ashley is, I'm just going to put it on the screen because they're asking, where is the clinic located? So Dr. Ashley, if you want to repeat where you're at before we get into the next question.
I'm 18 Kensington Road in Brampton. It's right down the street from Bramley City Center.
Awesome. All right. So there you go, Arlene. She's right in our neck of the woods. Family medicine is often the front door of healthcare. How does your identity shape the way you design the entrance for the diasporic people? So for people to come to you.
So I think approaching the encounters, especially with Black patients, from a sense of understanding, also addressing their needs that may have been overlooked, like we were talking about before. But I also find myself going above and beyond, advocating for these patients a lot more than I may have done in the past with my Arizona population, which was a complete 180 and a disconnect. So calling to follow up on things, speaking with other physicians directly, asking them for more details where other physicians might have just let it slip under the rug, or not fully complete a workup to its entirety.
Yeah.
So for me, I take a lot of pride and privilege in making sure that I'm holistic in my approach and going the extra mile when the extra mile is due, calling doctors, following up on my high-risk patients, following up on my cancer survivors or cancer patients, right? Yeah. So, other physicians I know for a fact would have just let things be, wait and see what happens with your referral. But for me, if it's something I prioritize, I attack it and I get down to the bottom of things and I make sure that any problem I have is solved, so that these patients are getting the care they deserve.
Okay, wow. Yes. Yeah, I do notice, like I was saying earlier to you, I'm not sure if it's you who's answering your emails, but I asked you earlier, like, what time does your practice close? And you said around 4 o'clock. But I know that your job doesn't end at 4 o'clock. It doesn't end at 4 o'clock.
Yeah,
You're
it's
constantly working. Yeah,
yeah.
making those phone calls, and we appreciate that. Thank you for that. Research shows that Black women in medicine, medical leadership often engage in legacy work.
Mm-hmm.
What is the legacy that you're trying to build through your practice, or is there a legacy that you're trying to build through your practice?
So the legacy I want to leave is one of approaching patients holistically. So that means addressing all of the social determinants of health that go into, what makes someone healthy, or what prevents someone from becoming healthy, essentially. So the legacy work that I currently am doing is trying to get out in the community, volunteer at certain places, provide healthcare where healthcare might not be accessible to certain patients outside of my practice. Getting involved with the Brampton community, and really trying to establish more of a community-based medicine model, which I feel like Ontario is lacking.
Yes.
Hopefully, it is my dream and my goal that with the help of maybe local government, that we can have an established community practice, or I can be a part or engage in a community practice where we're able to address not only the patient, but all the things that go into making them healthy, whether it's income, housing, access to food, transportation, all these things that matter. So that's something I want to leave behind when I finish practicing medicine, which is still another 40 years from now. But
you just started.
yeah,
Yeah.
I can get my foot in the door and start
Yeah.
working on those things. That's going to be the legacy work that I want to engage in.
Okay. All right. So I was just listening to you, and you're talking about your legacy work and the things you want to do. And I think Brampton is a place to do that. I think the mayor that we have today, he is very involved and invested in the Black community. So if you haven't already reached out to his office, I think that would be a great avenue to take a step towards. I myself had communications with his office, and he has come out to events that I've had for Black initiatives. So he's someone to have on your side. He's definitely a great ally to have for this initiative.
Good. Amazing. That's good to know.
For sure. So I wanted to I don't want to get sidetracked, but I do want to ask, so because we have a lot of different viewers that are on, and sometimes we take things for granted as desk work people, and we don't like to go to the doctor and check things out. What are some things, some illnesses or diseases that affect the Black community in particular that we should be aware of and also get checkups for?
Right. So particularly with the Black community, Black diaspora, diabetes, hypertension are quite common. So high blood pressure. There is a little bit of a genetic component, but there are a lot of modifiable risk factors that we need to take into account that are tied to our cultures, right? So they're tied to Caribbean foods, African foods, things like that, right? So diabetes and hypertension, obesity. So I know a lot of my patients want to look sexy at a certain weight, but unfortunately, sometimes that weight is going to be doing more harm than good. That's something we need to look into. And also cancers, right? There are certain types of breast cancers that are hormone receptor negative that attack or affect women, Black women particularly more.
What are those? I've never heard of that. I never ever knew that fact.
Yeah, so breast cancer, there's a few types. There's estrogen receptor, progesterone receptor, and then there's one that's negative for those receptors completely. So those are the breast cancers that are not treated with or are not as easily treated with medication. So that particular type of breast cancer affects Black women in greater proportions than the other types of breast cancer. So those are things that I encourage patients to get checked. So their annual blood work to look for diabetes, blood pressure check, and then primary prevention with screenings, particularly your mammogram, your pap smear, your colon cancer screening, those sort of things.
All right, so you all hear that, listeners and viewers? Get your tests done. I recently, I guess within the last 2 years or so, started doing my pap smear, not pap smear, my mammograms. That is something that not a lot of us think about doing, and to test for breast
Exactly.
cancer. So get your mammograms done. Don't be afraid of those machines. They're not going
Mhm.
to hurt you. They're going to more than likely save your life. So get those checks
Exactly.
done.
Exactly.
Okay. Um, so there was a question here. Are you
Mhm.
accepting new patients? I think you answered this already. So Dr. Sebastian was saying she's still accepting a few patients until she closes off very soon. So at the end of the show, Dr. Sebastian will leave her contact
Mhm.
information so you can contact her office, okay?
Perfect.
And there's another comment here. Welcome to our community.
Thank you. Thank you, Yvonne.
Yeah, so we were talking backstage, and I was just saying, ironically, you're down the hallway from my doctor, who is also a Black physician. So
Mhm.
they're there, but my doctor's not accepting patients right now. Dr.
Yeah.
Sebastian is. So thank you. All right. So I understand that your dad is also a doctor and your sister as
Yes.
well. Are they also in Brampton?
So they're also in the same building that I'm in.
Okay.
My dad's practice has been open for 30, 35 years, something like that.
Oh,
And then my
wow.
sister's been in practice for about 9 years. So
Okay.
we're all in the same building, and we're all family physicians.
I love it.
Mhm.
All right. This is it warms my heart, as I said. It's just like word of love going all around.
Yeah.
I'm just trying to fiddle with this. This is live TV. I'm fiddling with this, trying to plug in my laptop because I don't want it to die. But
No worries.
let me ask the next question. Um, how do you reframe? So, in many medical settings,
Mhm.
patients who don't follow a plan or labeled non or are labeled non-compliant, how
Mhm.
do you reframe this when working with patients who have cultural structural barriers?
So I think it comes from a place of understanding what the barrier to, for example, medication adherence is. Is it a
Mhm.
cost barrier? Is it a housing issue? Is it misunderstanding of how medications work? Or maybe it's just might be not understanding how to take medications, right? So
Mhm.
I typically ask those questions if patients aren't taking their medications and bring them in frequently, if it has to be every 2 weeks to every month, just to make sure
Yeah.
that we're following up on those chronic conditions. But we
Mhm.
have to really look at why aren't you taking your medication? Sometimes it is cost, right? Sometimes if you fall between a certain age range and you don't have insurance with your employer or you're uninsured, then those medications come at a cost, right?
Yes.
And that can
Yes.
be a barrier for some patients. So we really just have to address what it is that might be stopping them from taking medicines or stopping them from getting their screenings, and then tackling it individually and coming up with a plan to address those
Mhm.
conditions.
Mhm. So I'm gonna ask. It might come across as a funny kind of question, but
Um,
so I'm one of those people who think, okay, yes, I was prescribed something,
right.
but there's a tea that can help with this, and there's a herb that can help with this. Do you
Yeah.
get your patients telling you this?
Very common, yes. Herbal
Yeah.
supplements or naturopath things that naturopaths recommend, for example.
Yeah.
Um, but I try to educate as much as I can, and I try to be very blunt when I'm with patients, because there's evidence-based medicine, which is what I practice, and not
Right.
some herbs and teas and herbal things are not going to cure certain things like cancer, right? So
Right.
we have to be sensitive to culture, but also realistic in the evidence that's been proven time and time again through medical practice.
Right. All right.
Yeah,
So I'm going to take this moment to plug in my
no worries.
my laptop, Dr. Ashley. Sorry, guys.
No worries.
Okay. I apologize. So there's a question here. Um, Can you let the female viewers know up to what age you should have a PAPS test and also a mammogram?
So the guidelines right now say around 69 for your pap test. You should be getting it done based on the old guidelines every 3 years if you had pap test alone. They have now switched it to every 5 years if you have HPV screening. And HPV screening looks for a virus that can lead to cervical cancer. For mammogram, you start at age 40 unless you have a first-degree relative who was diagnosed with breast cancer. In that case, you are starting your screening 10 years before. So if your mom was diagnosed at 35, then you start screening at 25. So 10 years before, and typically up to age 79, but it's not, it's all individual, case by case, but in the average risk individual, up to 79 is fine, 75 to 79.
Okay. Thank you for that. I have kind of a personal question. So a while back, something was sent to me in the mail for me to do one of those feces tests.
Mm-hmm.
So I was like, I'm not doing this. And so I didn't do it.
Mm-hmm.
I know they may send it again. What are the... Can I get in trouble for not doing that test, or should I just wait for the test to come back again?
So you should have your doctor order that test. FIT test starts at age 50 in Ontario. So it's a test that takes a sample of your poop and it's looking for blood. And blood is usually the first sign of some malignancies, colon cancers, right? So if it does pick up blood on the test, then they send you for a colonoscopy where they'll go in with a camera and they'll look to see if there's any polyps, any hemorrhoids, any kind of like growths that might be predisposing you or like may put you at risk of cancer. So definitely is one of those tests I recommend as part of routine health maintenance. So that goes along with your mammogram, your pap smear, your FIT test or colonoscopy, depending on your risk factors. And then lung cancer screening if you are a smoker.
Okay. All right. So let's not ignore. I now need to request. I don't think I ever told my doctor that I got that, actually.
Yes, definitely.
I never told her that. I think, yeah. So I need to have that conversation with my doctor. But I appreciate that. Maternal health crisis. There's a maternal health crisis with our community.
Mm-hmm.
As a family physician, how are you specifically addressing the alarming disparities in maternal morality for Black women in your daily practice?
So for pregnant patients specifically, there's intervals that they need to follow up within the first 20 weeks. So that includes some blood work. It also includes ultrasounds. And they come at very specific times during the pregnancy. So making sure that your patients are being adherent with the plan to come back and follow up is always going to be key. So within the first 20 weeks, you'll see that patient maybe 4 or 5 times, a lot more than the average patient. And during those visits, you address any concerns, you make sure they're taking all their medicines. If anything comes back on screenings, you discuss that with them, for example. So that's one approach that I take. After 20 weeks is where sometimes the pregnancy progresses and is often handed off to an OBGYN. And sometimes OBGYNs, depending on who you get, right, they may be dismissive or they may not take your concerns as serious. So unfortunately, the burden of advocacy sometimes falls on the patient, especially later on in pregnancy where that care is transitioned to the specialist. But I would hope and I have faith that, patients are still getting adequate care from OBGYNs, but I have heard cases of patients who have been ignored. So I tell them anything where you feel abnormal, any inkling that something's wrong, don't even hesitate, go straight to the hospital. And you can go to the hospital as many times as you need to until you feel seen and heard. Fortunately, we have a public healthcare system, so there's no cost to doing that. So if you don't like how you felt at Credit Valley, then, go to Orangeville. Because at the end of the day, sometimes you have to take it into your own hands and get the answers that you need.
Right. Okay. So, for our listening audience and viewers, you don't have to, I mean, yes, you want to take the word of your doctor, but sometimes it's good to take, get another opinion, right? To make sure that um, you're okay with the answers that you're getting. Okay.
Yeah, of course, especially if you don't feel seen or heard, or
Yeah.
something is urgent or overlooked. There's no hindrance to just going to a different hospital.
Yes.
I probably shouldn't be advocating for that, but it's the healthcare system we live in, and it allows us to have that opportunity, something that our US counterparts don't have the opportunity.
Right. Okay. So this question already was asked. I think we're moving on to the next question afterwards. There we go. Is it very important to do the feces test? It is very important. Sorry. This is
No,
how
right.
they
Picked
picked
up.
up on colon cancer, her colon
Of
cancer.
course, yes, it's
Yeah.
very important.
hmm So and that's my mom, by the way.
Uh-huh.
So and I have a feeling why. I think I know why it was sent to me because they saw that my mom had it, so
Then
they
you
probably
need to
sent it
get
to
your
me earlier.
screening. You need to get a colonoscopy, actually,
Yeah,
not the feces test.
not the feces test.
Mhm.
Really? Colonoscopy? So I
Yeah.
should request that?
So yes, because the guidelines are you have a first degree relative that has had colon cancer, right? So in that case, it puts you at risk, and you need to start screening at the very least 10 years before your first degree relative.
Okay.
I would recommend, honestly, a colonoscopy.
Okay.
Mhm.
Thank you, Dr. Ashley. Genetics versus social. How would you balance discussing genetic dispositions like hypertension or sickle cell without
Mhm.
reinforcing harmful stereotypes or ignoring social determinants of of health?
Yeah, so you definitely need to take into account the genetic component, particularly in diseases like diabetes. But
Mhm.
at the same time, we have to address some of the modifiable risk factors that are at play that might reduce your risk of contracting some of these diseases or developing some of these diseases like diabetes, for example. So diabetes is 50% hereditary. So you have a 50% chance of getting diabetes if your mom or your dad has it.
Mhm.
However, if you work really hard on diet, exercise, weight loss, things like that, it can reduce your risk of developing the condition. So there's a bit of genetic component, but then there's also things you can do in your daily life, modifiable risk factors that you can take every day to reduce some of that your chances of developing those conditions.
Okay, and I believe you when you say that, because
Yeah.
I there's many times when I did blood works and I was like borderline
Yes.
diabetic,
Right.
borderline diabetic. So I was like nearing it, and then when I heard borderline, I was like, okay, I'm gonna start doing this, more exercise, more sleep,
Right.
and changing my diet, and then that corrected those factors. So we
Exactly.
essentially we could correct these things if we do the right things.
Exactly.
Okay, right. Um, Traditional healing. So we just talked about that,
Mhm.
herbs and stuff. Do you, I know you're more theoretical and more research based,
Yeah.
but I know you're probably not even supposed to say yes, you do tell patients to try this and try that. But how do you integrate these home truths into a clinical treatment plan
Mhm.
without being dismissive? To
So you're
what? We're going back to that question.
Yeah,
Yeah.
so working with the patients, right, can always incorporate your supplements and your herbal remedies, your cultural specific remedies. There's nothing wrong with that. But we can do that in conjunction with evidence based medications and guidelines to help improve your overall health. There may be some truth to some of these herbal supplements, right? They've been around for years or thousands of years sometimes, like Chinese medicine, for example.
Mhm.
So you can work hand in hand with both, uh, but keeping in mind that there is scientific based evidence that we also have to follow that has proven outcomes that sometimes the herbal remedies don't have, or they don't have studies to back their efficacy. So working in conjunction with the patient and marrying the two is always a good starting point.
Okay. Thank you for that. So I just want to remind the viewers that they can send in questions. A lot of our questions are coming in on the YouTube platform, but you could also send questions on Facebook, Instagram, and also that text number. So you can send a text to 647-495-3224 if you want to chime in on the conversation with Dr. Sebastian. All right. So here I have a comment. Great health information for our community. Yes, this is awesome information for our community. Thank you for that comment. So let's look at the family unit for a minute. In many African cultures, medical decisions aren't individual. They are. How do you navigate the family in the room dynamic during consultation? Have you ever experienced that, where there's a family coming in?
Of course, yeah. So family dynamics are they can be interesting, right? Because sometimes the family wants something for the patient that the patient doesn't want. So always making sure that they're okay and comfortable with other family members in the room. Addressing the concerns of the patient first and foremost, and then listening to their family members' concerns to see if there's anything of validity there that we can always talk about together. So it's a collaborative approach. As long as the patient is comfortable with their family members there during their encounter, then we can always work together to elicit a plan and to come up with some ideas as to how to tackle their concerns, or even address concerns that the patient may not be aware of. Things like dementia, for example, those patients may not be aware that they're losing their memory, but family members are often the very first people to pick up on these things. So it's a collaborative approach.
Okay, thank you so much for that. I do go into the office a lot with my dad, and he lets me talk for him.
Oh, very good.
Sometimes I say, you answer. He's talking to you. The doctor's talking to you. But we do that communal, I guess, visits. We do those visits. I wanted to ask you if you've ever been discriminated against because of your age, and an older or more mature patients coming to you and saying, what are your credentials? Have you ever been asked those questions?
All the time. I mean, what can you do? You got to start somewhere, right?
Right, exactly.
Starts from the beginning, and
that's right.
I can't change my age, but I know that I have studied for many years, and I came top in my board exam, so I know my stuff. So it's up to them.
Yeah, exactly. Exactly. I like how you said that. You have to start somewhere.
Exactly.
Because, obviously you have your education and your schooling, and your degree is on the wall, I'm pretty sure, and they can see that.
Yeah.
We also need to celebrate that we have this physician not to question too many times, right?
Right.
Yeah. Language and literacy. For recent immigrants, because we have a lot of immigrants that are coming to our country, a lot from West Africa these days, so Ghana, Nigeria, and even from the Caribbean. What translation work do you do beyond just language? Do you how do you ensure that patients feel that they're truly heard by you? Do they come with their interpreter, or how is that communication done with you?
So unfortunately here in Ontario, everybody kind of operates in a silo. So all the practices here are not integrated or connected. And I say that to say in the US, they have a more robust system where there are interpreter systems and phone numbers and lines and iPads you can call and get somebody on the phone that speaks patient's language, like their actual communicative language. But here in Ontario, we don't have necessarily broad access to those services, so it can be tricky. I have offered patients to see certain doctors that are of the same culture, race, ethnicity, just so that that language barrier isn't there, that cultural barrier isn't there. And I give that option because I feel like I'd be doing them a disservice if I don't understand, one, your language when we're communicating, and two, if there's some cultural things that I'm not familiar with. I think sometimes you can get better care if you're with somebody who understands a little bit more. So that's always a shared decision between me and the patient. Some stay and it can be a little bit challenging. And then some agree that, they should be with somebody who understands the foods, the culture, the music, the religious practices that might come with some of their, come at certain, like Ramadan, for example, certain times of the year, so that they can get the optimized care that they deserve.
Makes sense. Okay, so you're not gatekeeping.
No. I think it's so important to be paired with somebody that you can understand, not just from a language perspective, but from a cultural and religious perspective too.
For sure.
Yeah.
Thank you for that. The trust deficit. Let's see. Given the history of medical racism, and I think we talked about that a little bit earlier, many Black patients enter the office with a protective shield. But what is your specific ritual or approach for lowering the shield for those patients?
So having an open communication with patients, I have a standard set of questions that I ask everybody when they come in, but just honestly being myself. I'm pretty friendly by nature, so I think that usually breaks down the barrier sometimes for patients that might have not had the greatest experience with other physicians. So just listening, understanding, and then just communicating with patients of different ages, for example, and delivering the information in a way that they understand is how I typically approach those situations.
Okay. So you're listening and you're hearing about Dr. Ashley. So I hope you're getting your pen and paper ready for the end of the show for when she gives her information. And she's only taking a few more patients. So get your pen and paper ready because this is what you're going to get, right? You're going to get a genuine doctor who's going to give you the primary care that you need. Okay. Nutrition and soul. Diet is a huge part of family medicine. How do you give heart healthy advice to respects of traditional foods like talked about that, like jollof rice, pounded yam, Caribbean spices. I'll tell you a little story. So I took my dad to see a dietitian. The dietitian was not of the same culture. And so she proceeded to offer different options for my dad to eat to change his diet. And I was like, well, he doesn't eat those things.
Right.
So is there anything that you can think of culturally? Like you knew this was the patient. Could you not have researched a little bit more about this culture to offer him these options? Like how is it for you when you're telling your patient to maybe not so much coconut milk or not so much starchy foods? Like how do you have that conversation with your patients?
So it's more so about the preparation of the food. You can still honor your culture and your traditions, but how you prepare the food is going to be important. So reducing oils, for example, reducing, like you said, some coconut milk, some butter, still having the same essence of the meal, but preparing it in ways that are a little bit more healthy. For example, using baked chicken breast instead of preparing it in other fashions is a great place to start. Reducing oil if you can. If you're cooking, for example, plantain, instead of putting in oil, you can put it in the air fryer. So those are some little changes you can make, but it's more so in the preparation and reducing the additives that you add to the food that can help make that same meal just a little bit healthier for you.
Okay. You hear that? We can still do it. We still have our great chicken. Instead of doing fried chicken, you can do a shake and bake in the oven.
Right, exactly.
All right. So there are options. So don't feel like, oh, I just have to have my Caribbean food, and you won't be able to have it if you don't prepare it a certain way. So you can prepare it a certain way. Okay.
Right.
So the clinical environment, let's look at that for a few minutes. If you
Mhm.
could redesign your waiting room or clinical
Oh, I think it froze.
Did you freeze for a second?
Yeah, I think it froze.
Yeah, and I'm freezing as I'm talking. I don't know what's
Oh,
happening.
no worries.
So if you can redesign, I walked into your office, and I walk into many different offices, and they look very generic, right?
Mhm.
They look like
Mhm.
an office, a doctor's office. If you could redesign, or have you ever thought about redesigning your office space to make it look more homely to, I mean, you do have a variety of different diasporic people.
Yeah.
So how can you, if you could, how would you?
So I think I would start maybe with resources for Black patients, different like therapists they could go to, or nutritionists, physical therapists, people in the community that represent their values and culture. I would start there as a great place, so that it's more open and inviting to collaborating with other providers that that will understand them and understand their needs and their culture as well. But I'd start there.
Okay. So I think a question came in the back.
Mm-hmm.
Um, as a physician who's worked both in the US and in Canada,
Mm-hmm.
have you seen a difference in the level of medical racism? Do patients feel served better in Canada, or is it the same in your experience or opinion?
That's a tricky one. I think they both have the same principles. The racism is still based on the same principles, essentially.
Hmm.
The US has a bigger population, so the patients in larger inner cities have more exposure to Black doctors than
Hmm.
here in Ontario. We have Black doctors, but not in the same numbers that we're seeing in some places like Chicago where I practice, right?
Yeah.
I think the bottom line is patients still in both places feel dismissed. They feel judged. They're often painted with like a broad brush. All Black people are the same sort of attitude, which
Hmm.
I've experienced as a patient myself here in Ontario of another doctor. So it's been it's 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 a challenge, but it's something that is similar in both places. There's similarities into the way Black patients are treated in both places, and I think that definitely needs to change by
Hmm.
having more Black physicians of multiple different specialties in surgery, dermatology, ophthalmology, all the specialties, right?
Yeah. Well,
But
thank you for that. Yeah.
yeah.
Do you wanted to add something else?
No, I think, yeah, it definitely there's some work that needs to be done in that space, but the racism is still the same in both
Mhm.
countries, maybe a little bit more in your face in the United States than it is in Canada,
Yeah.
but it's still there.
Yeah. I think in Canada, it's more covert than
Exactly.
overt.
Right.
So it exists here too. It's
It
just
does.
like they kind of like um, sugarcoat it a little
Exactly.
bit over
Yeah,
here.
exactly.
Right. And that's when, when you heard Dr. Ashley say, or Dr. Sebastian say, if you're not comfortable, check it out with another physician, just
Mhm.
ask for another opinion, right?
Exactly.
You don't have to take that doctor's opinion. I think I'm freezing somewhere along the way here. um, what is the one thing that you don't teach, that they don't teach in medical school about serving the diaspora, um, that every young Black doctor needs to know?
So what they tend to do is treat all Black patients as a monolith. we're all the same. Our needs are all the same. We all are coming from a certain socioeconomic status, which is not true, right? They need to do a better job at highlighting the spectrum of patients, of Black patients, the ethnicities that are within each culture, right? Because we're not just all one. For example, when I was in the US, it was African American, right? I'm not African American. I'm Afro-Caribbean. You can say I'm Afro-Canadian, but the culture that those patients were raised in and that they grew up in is very different from the culture that I grew up in. But they teach you that we're all the same and that our needs are all the same and that we all come from an impoverished lifestyle. We all come from a struggle. But as you and I know, this is not the case. We are a spectrum. We come from different places. We have different education levels. We have different ethnicities within the Black community. So I wish they would have highlighted that a little bit more so that we're not just treated as one, but treated who we are individually.
And that's your education in the States, right?
I'm sure it's similar here in Canada, but
pretty sure.
Usually they paint us all with this brush, but as you know, there are Black patients from Spanish-speaking countries. There are Black patients from French-speaking countries. You know, there are Muslim Black people. So,
Interesting. I don't know if it's a true fact, but there was I don't know if it was U of T most recently. Within the last little while, they weren't accepting of, there was like some gatekeeping happening with Black students entering into the medical school. I think that I got to get the facts right, but I was hearing that there was some gatekeeping. They weren't, there was like almost a law against it, but it wasn't being practiced. So their law was still in existence. They didn't, I guess, dismantle that law. It was there, but they were still letting doctors in, Black doctors in, but the law still existed, if that makes any sense.
They weren't, I understand.
So anyway, so that's just a quick fact about Toronto and the gatekeeping that happens.
Right.
It happens with, the education system as well. So there's a lot of that happens. So don't be afraid to ask your questions. We're having a great conversation. We're winding down, but don't be afraid to ask your question as well to Dr. Ashley. How do you protect your own mental and physical wellness so you can continue your work? Because I know it's a lot. Sometimes people are coming to you like the weight is on your shoulder as representing the community. How do you take care of yourself?
So I've been struggling with that over the last couple months. Like you said, the weight is on my shoulder, representing the whole community. Sometimes it feels like, but prioritizing my time off. I was working 6 days a week up until February. And as you can imagine, that takes a toll on you. So I've been able to scale back my hours a little bit, make some more time for myself, take some breaks and spend some time with friends and family a little bit more so that I'm recharged and I can start the week better prepared and a lot more refreshed than when I started practicing, when I was doing 6 to 7 days consecutively every week. But it's the nature of the beast.
Well, it's starting up. I mean, you get your name out there, and being very busy in your practice is important, because if you don't do it, who's going to do it? Right? You're building your business, and you're setting a pathway for your legacy to set roots. But I'm glad that you mentioned that you're taking time for yourself, you're scaling back. So for the viewers that are working so hard, I'm one of those workers who works so hard, and sometimes I have to remind myself to also take some mental health breaks and wellness days. So I'm glad that you're doing that for yourself so you can be well for us as well. Because if you're not well, you can't be well for your patients.
Right, exactly.
Right?
Mm-hmm.
Okay. All right, so we're almost at the end. So this is the time I'm going to take to allow you to tell the viewers where to find you, if you want to give your address, your suite number, your phone number, so they can call the office to get in contact with you to become a new patient, and maybe tell them a little bit about the process. So get your pens and papers, viewers and listeners. Dr. Ashley Sebastian is going to tell you how to find her to become one of her patients.
Yeah, so I'm at 18 Kensington Road, office 504. Our phone number is 905-216-8256. You can always call and let us know that you'd like to register as a new patient. And then you can always find me online as just my first and last name, Ashley Sebastian, on Instagram, TikTok.
Yeah, that's how I found her. And you know what? When I contacted Ashley, Dr. Ashley's office, it was speedy. It was very quick. And even now, like we've been communicating with over the past few days, very quick response. So it's not like you're going to be waiting and like, oh my gosh, when is this doctor going to get back to me? There's a very quick response time. And I really appreciate that. Even though I'm not one of your patients, you have been very quick to respond. Even if it wasn't you and one of your colleagues or someone that works in the office, I really appreciated that. Thank you for that. So anything you want to share just before we end the show about how can we help you as a Black doctor in the Brampton or Peel region area? I know you talked about wanting to set that legacy. If anybody can help, like politically or in the medical field, if someone can help you, like, is there anything that you want from the community to support you?
Yeah, it's a great question. I think sharing any resources that you have that I can take back and incorporate into my practice and share with other patients, since I'm relatively new back to living in Canada and living in Ontario. So there's so many resources and community groups that I'm probably not privy to just yet. But if people could share those with me, that'd be great.
Okay. So you heard it yourself. Dr. Ashley's putting our call out. One more thing before I let you go. Do you also, are you also working in peds, like pediatrics? Are you a pediatric doctor as well?
No, I see 16 plus at the time, yeah.
Okay, just asking for personal reasons.
Yeah.
All right, so we're going to end the show soon, but somebody wants to say thanks to Dr. Sebastian. Thank you so much for coming on and blessing Minds in Motion with your knowledge and giving the viewers a plethora of information. So if you want Dr. Ashley to be your doctor, reach out to her at 18 Kensington Road in Brampton, close to Bramley City Center. And she did give her phone number. If you want to give that phone number one more time. It's
905-216-8256.
All right. Thank you so much.
Thank you.
And don't log off for those viewers that are on. We have another show for you. It's called This Week in Interview with Anthony Drago. It's right after this show. We're going to end the show, and I'm going to say thank you so much, Dr. Ashley, for your time, for being on our show. And I'm going to communicate with you about something that I have in mind. All right.
Awesome. Thank you for having me.
All right. Take care.
Have a good one. Good night, everyone.
Have a great night. Bye-bye.
I'm talking Joe podcast, Minds in Motion. Talk about relationships, help your emotions, behavior management when your kids start to losing it. Talk about life and all the confusion. Minds in Motion. Minds in Motion. Talk about relationships. I'm talking Talking Joe podcast, minds in motion. Talk about relationships, help your emotions. Behavior management when your kids start to losing it. Talk about life and all the confusion. Minds in motion. Minds in motion. Talk about relationships. Emotion. Minds in motion. Talk about relationships.